presented by Dr. Kalyan Varma, Professor, Forensic Medicine and Toxicology. I will never look at death certificates the same way after learning this. High in the Himalayas, a lone climber is found dead in his tent. No signs of struggle, no obvious injuries. A tragic accident? Perhaps. But without a clear understanding of what happened, the climber's family is left grappling with unanswered questions. Was it a medical event, equipment failure, or something else entirely? The answer, shrouded in the thin mountain air, hinges on one crucial piece of the puzzle: the death certificate. This scenario, while fictionalized, underscores a reality often overlooked. Death certificates are not just bureaucratic formalities, they are vital documents that provide closure, guide legal proceedings, and shape our understanding of mortality. In this case, an accurate cause of death could bring closure to a grieving family, inform future climbers about potential risks, and even guide rescue protocols. The seemingly simple act of filling out a death certificate carries profound weight. Decoding death: the journey from hospital bed to death certificate. The journey of a death certificate begins at the bedside, where doctors grapple with the complex task of determining the cause of death. This is rarely straightforward. It requires a meticulous review of medical history, examination of the body, and often additional investigations like autopsies. The physician's role is to piece together the events leading to death, identifying the underlying disease or injury, the cause of death, and any contributing factors. Once the cause of death is established, the information is translated into a standardized format on the death certificate. This document captures not just the immediate cause of death, but also underlying conditions and external factors, painting a comprehensive picture of the individual's demise. This information is then used by public health officials to track mortality trends, identify health risks, and develop targeted interventions. The weight of the pen when doctors make mistakes. While the process may seem straightforward, the reality is far more nuanced. Physicians, despite their training, face significant challenges in accurately certifying deaths. Time constraints, lack of specialized training, and the inherent complexity of certain cases can lead to errors. These errors can range from minor inconsistencies to misclassifications with significant consequences. Imagine a case where a patient with diabetes dies from a heart attack. A doctor pressed for time might simply list heart attack as the cause of death. However, failing to mention the underlying diabetes paints an incomplete picture. This omission can skew national statistics on diabetes-related deaths, impacting resource allocation for research and treatment. The weight of the pen in the hands of a physician extends far beyond the individual case. Echoes of inaccuracy: the ripple effect of errors on public health. The ripple effects of inaccurate death certificates extend far beyond the individual. Public health initiatives rely heavily on accurate mortality data to identify trends, allocate resources, and develop effective policies. When death certificates contain errors or omissions, these initiatives can be misled, leading to misinformed decisions and potentially harming public health. Consider the case of HIV/AIDS in the 1980s. Initial underreporting of deaths due to social stigma and lack of diagnostic tools hampered early efforts to understand and control the epidemic. Accurate death reporting is not just about individual cases. It's about painting an accurate picture of our collective health. Ensuring accuracy: a call for clarity and collaboration. Improving the accuracy of death certificates requires a multi-pronged approach. Clearer guidelines, standardized training for physicians, and improved communication between healthcare professionals are crucial steps. Technological advancements, such as electronic death registration systems, can minimize errors and streamline data collection. Beyond technological solutions, fostering a culture of open communication between healthcare professionals, families, and medical examiners is paramount. Discussing the cause of death with sensitivity and clarity can provide closure for families, while ensuring accurate information is recorded. Now, let's delve into the practicalities of drafting a medical certificate of cause of death, MCCD. This certificate is a critical document that must be completed with utmost accuracy. Let's consider a case study: a 56-year-old male with a chronic history of asthma and diabetes mellitus for the past 10 years. 2 weeks prior to his death, he developed gangrene in his right lower limb. Further investigation revealed that he had septicemia, which eventually led to his demise on June 1, 2024. In this scenario, the cause of death must be carefully documented in the MCCD format. The sequence is crucial. Immediate cause will be septicemia, antecedent, Cause will be gangrene of limb since 2 weeks. Underlying cause will be diabetes. Mellitus since 10 years. Other significant cause contributing to death is asthma. This meticulous documentation ensures that the death certificate reflects the true medical history and conditions leading to the individual's passing. By accurately filling out these details, healthcare professionals can provide clear and reliable data, which is essential for public health records and future medical research. This process not only honors the deceased, but also aids in the ongoing quest for medical accuracy and improvement. The legacy we leave behind. Accurate death certificates for a healthier future. Death certificates are more than just legal documents. They are testaments to lives lived and reflections of our collective health. Accurate death reporting is not merely a bureaucratic necessity, it is an ethical imperative. By striving for precision and clarity in medical certification, we honor the deceased, empower their families, and contribute to a healthier future for all. Each death certificate, meticulously and accurately completed, adds a stitch to the tapestry of our understanding of human mortality. These records, seemingly insignificant on their own, collectively illuminate the path toward better health, prevention, and ultimately, a better life for all.